Digital Health Exclusion Study. This animation describes a study undertaken by researchers at University College London, exploring community support for groups less likely to access the internet. The internet has become an important part of daily life. If you try to book a GP appointment, you are encouraged to do this online. However, 1 in 5 people in England don't have the skills needed to do this. Others cannot afford devices or internet access, or don't feel motivated. This is known as digital health exclusion, or not being able to make the most of the internet for your health. What is even more worrying is that groups who already suffer the worst health are those most likely to experience digital health exclusion. These include older people, people with less income or education, and people who don't have English as a first language. That is why the government and local councils are supporting community organisations to help people overcome the barriers to accessing the internet. We worked with 100% Digital Leads, a citywide programme in the north of England, which works with community organisations to provide digital health hubs for disadvantaged communities. The aim of the research was to explore if and how digital health hubs support people to access digital health services. We visited 10 digital health hubs and talked to 18 service users and 12 staff members in the most deprived areas of Leeds. We found that what people find most helpful is community spaces, social activities and devices and Wi-Fi, and person-centred support through community understanding, personalised regular support and trusting relationships. We identified a number of short to mid-term impacts experienced by service users, which include confidence and agency, social connection, improved mental health, and basic digital skills. We also identified several barriers to digital health services, including inconsistency in app or website provision between GP practices or hospitals in a local area. In conclusion, our research suggests digital health hubs do contribute to supporting people access digital health services. But crucially, we think they do this not just by building digital skills, but by providing community-led recipient-centred support, which centres the unique needs of specific local communities. Findings have been shared via scientific papers, conferences, blogs and websites to help decision-makers plan services to support people at risk of digital health exclusion. You can read more here at our research study webpage.